weather forecast today?
Today's forecast, a lot of sunshine, blue skies, marine clouds. Just a perfect day to go outside and relax. That's your forecast. We'll be right back.
Yeah, sunny days, sunny days, sunny days. No clouds in the sky, but again, away feels like it's been a...
Welcome back to another episode of The Social Beaches. I'm Kelly Bowling.
I'm Carolyn Smith.
And we're with the Coastal Estate team at Compass. We sell real estate in Brevard County and down into Indian River County. So that's everywhere from Mims and Titusville into Cocoa, Vieira, Suntree, Melbourne, Palm Bay, all the beachside towns, Cocoa Beach, Merritt Island, Indy Atlantic, Melbourne Beach.
She's going to name them all.
I'm going to name them all. Not all of them. This is not true. There's too many to name.
Yes.
And, of course, down into Sebastian and Vero Beach. So
Yes.
if you have any real estate needs to buy or sell, or you just have general real estate questions, you can call us at 321-422-2160. You can email us at hello@coastalestateteam.com, or you can message us wherever you are seeing this.
Right. Or leave us a comment. We do read our comments.
We love comments. Yeah.
Leave us good ones.
Yeah.
So we're going to talk very briefly about the real estate changes that are coming. And we are not going to discuss the lawsuit. We're not going to discuss the proposed settlement, which is supposed to go into effect in July. We're just going to talk a little bit about how we and our team are going to be handling our business going forward.
Right. Yes.
Which is business as usual.
Yes.
For
We're going to
us.
continue to provide the same level of service that we've always provided to both our buyers and our sellers.
Yes. And to other parties. We pride ourselves on being a luxury brand. We're with Compass. Our boutique, we're a very boutique type of team. We provide a higher level of service, and we're just going to continue to do that. And it's going to be business as usual for us.
Yes, absolutely.
We've
got a lot of great tools at our disposal through Compass, and then the additional tools that we have as our team as well,
right,
to be able to provide a different level of service to our clients.
And our support staff is staying the same. So we're hopeful that if you have questions about specifically, we've had, of course, some of our clients and other people reach out and ask us, hey, what's going on with that? And we're happy to discuss that with you. So feel free to reach out to us and we can discuss that with you. But for us, it's more it's the same. It's the same. So
definitely.
Anyway. And then we're going to talk about health insurance in America. That's our main topic for today.
This is a hot button topic, I feel like, because especially we're self-employed.
Fun.
So that means we get to do the marketplace for health insurance.
A lot of people I don't think realize, because they think, well, you're realtors, you're part of a group, right? So you're part of a large group
like
that is
Compass.
or Compass, or part of the National Association of Realtors, Florida Association of Realtors, your local board, whatever. There's groups within that, and people think that these groups can insure as a group.
If only. Wouldn't that be nice?
Yeah, it's not allowed right now. And so there's potential for laws to be passed to allow groups to, it's lobbying, right? It's lobbying by the insurance industries to not allow people to band together to get the same benefit that large companies can get as far as insurance rates, insurance coverage, all those things. So we can't.
No.
Our only option is if you have a spouse, and you can insure through your spouse.
Right.
Or as a realtor, our only option is to use the marketplace.
Yes.
Yeah.
And I think it was called the Affordable Health Care Act, right? It's really not affordable.
It's not affordable. I am grateful for it because it's the only, before that, you could not get insurance for pre-existing conditions, and now you can.
Yes.
So at least you can get insurance, number one, and two, it has to cover pre-existing conditions. But what they do is they give you credits based on your income. So if your income is a certain amount or below a certain amount, you get a credit.
Well, if it's too low, you get no credits.
That's true.
So if you have zero income.
Because then they want you to have what? Medicaid, Medicare, Medicaid.
Yeah, but then you have to be in a qualifying position for that too. Like, for instance, Carissa. Okay? She has zero earned income because she's in school full time.
Yes.
But she's over that threshold of being able to be insured under me. She also doesn't live with me in the same area. So her healthcare plan would be different because in Florida, ours are more regional, I feel like. So she doesn't qualify, so we have to pay full price for her plan. So then it's like, okay, we're going to do a high deductible, like, kind of plan. You have to kind of gauge how healthy are they? How often do they need to see a doctor? What medical conditions does she have? What medications is she taking? And there's no one size fits all, like to match all of these things. Like when you put your doctors and your medications in, you might find a plan that covers that doctor, but not that medication. Well, what's more important, So
it's
then you
true.
have to figure it out.
And the cost is crazy. I mean, the cost is really, it's really, really, really crazy.
Expensive.
And the other thing is there's so many plans, and I understand, right? But there's so many plans that I used to work so many, many years ago, many, many moons ago, when I got out of college. My first job was in a corporation. I worked in finance, and then I worked in corporate benefits. So I used to work with healthcare plans. So I understand more about healthcare plans than most people. And so I go in and I'm like, the difference between this plan and this plan, they're right next to each other, right? The difference between them is so minimal, and a little tiny cost. Most people could never figure that out. I think this is a true case where if you can find an insurance agent who's good, a health insurance agent who's good, who works with those plans, and is willing to help you navigate and select, and you trust them, I think it's a time definitely to maybe use a health insurance agent.
Absolutely. It's worth it for sure. I know I had to have somebody help me the first time I was doing the marketplace because I'm like, I don't know what I'm looking at. I don't know how to do this.
Yeah.
And because of our situation with like adult kids, some living at home, some living at school, do they need different plans? And it's a lot to figure out. And also we're like, we're a blended family. So I've got a kid who has a dad in another state, and what has he filed? It's a lot of stuff. Now that he's older, it's a little bit easier. We got Jacob that catastrophic only, and it's still like it covers nothing. Let's be real.
But the catastrophic plan. So then I said for myself, I'm like, maybe I should just get a catastrophic plan.
You can't. You're too old.
You can't because I'm
you have
too
to be
old.
Under what was the age? It was
30 or something.
I think it's even younger than that.
It might be 25.
Yeah.
You can't get a catastrophic plan. So I ended up picking a plan. This was so interesting to me because I really dug in, and I was like, I kept narrowing it down. And I found a plan. So to add my primary care doctor, all my other doctors, which I don't go to all the time, but anybody else, my pharmacy, everybody else was on this plan, but my primary care doctor. To go up to another level that would include my primary care doctor was an additional $350 a month.
At that point, you're not going every month to primary.
Right.
You just pay out of pocket.
So I was like, I'll pay out of pocket.
Yeah.
So I reach out to the doctor, and I'm like, hey, what's it going to cost for me to come in and have my annual wellness visit, just a regular wellness visit? So they send off whatever, and they come back and they send me a letter, and they're like $130.
Worth it.
That's less than the cost of 1 month of upgrading.
Yes.
And I don't generally, like, if I'm sick, like if I don't feel well, it's usually a night, a weekend anyway, or I just go to the walk-in clinic.
That's what we see. I rarely see my primary. I try to do it annually, but let's be real. Sometimes it's every couple of years because I'm relatively healthy.
Yeah.
I feel like I don't need to go. And then when you are sick, they don't have an appointment anyway, and it's
That's
further
the thing.
away. So
they don't have an appointment. You have to wait a few days, or you just go to the walk-in.
Yeah, I always go to the walk-in, and honestly, like the cost to go to the walk-in is about the same.
Yes.
For out of pocket if you have
Yes.
no insurance.
Yes.
Yeah. The other thing about the marketplace, though, when you're self-employed, is you have to know, and in our case, this is difficult. You have to know how much are you going to earn.
Yes.
Because if you under-report your income and they give you too many credits, you get to pay those back.
You do.
And I had a twofold situation because I thought I was going to make this much. I ended up making a little bit more.
Yeah.
So not only had they given me too much credits, but then my husband got his 100% disability rating through the VA, and we applied for CHAMP. They backdated the CHAMP coverage. So not only did I have to pay back the overage, I had to pay all of it back because they're you had government health insurance backdated to this date, which I didn't know about until the end of the year. It was literally like December 29th that we got notification.
But how could you even...
There needs to be some sort of...
Yeah, that doesn't make sense because
exception for that. So
Yeah.
I ended up paying it was almost $9,000 back
Oh
last year.
my God.
Yeah, all my taxes. Yeah.
Oh my God.
There needs to be something for the whole benefit of having the CHAMP is to you
Yeah,
know, give you
yeah.
access to healthcare and reduce your out-of-pocket costs. And that definitely did not do it. So I'm hoping that it starts to pay for itself, you know, because at this point, my free healthcare has cost me a lot of dollars.
Yes, that's so expensive. The estimating was really hard because this is the first year I had to do the marketplace.
Yeah.
And they're like estimating. I'm like, I don't know. I have no idea. I mean, I know it sounds crazy, but we have no idea what our income's
we
going to
never
be.
know.
So I
No.
just picked a number and I'm like, well, if I have to pay it back, I'm going to have to pay back the little subsidy they gave me. Now, in Kyle's case, because he does like a really high, because he had cancer.
Right.
So he, and he goes to Moffitt. So he has a very good plan, a very good plan. And every year they discontinue it, by the way. And then they're like, that plan's no longer offered.
But here's a similar one.
Here's a similar one,
Yeah.
which really isn't. So then I have to go through and find the right one. But he gets a very large subsidy because he's disabled and you know, that kind of thing. So he gets a large subsidy, but the same thing, like he has to earn a certain amount to be able to get the subsidy, because if you earn below that,
Then you don't qualify.
then you don't qualify.
Which is crazy. Why? It's so confusing.
It's really
So
confusing.
then, you know, you do have the option of just not having insurance.
Correct. Which some people
health.
are recommending. If you see,
Oh, yeah.
there's like videos on the internet and
Yeah.
stuff about just go bare,
Yes.
don't have it,
It makes
pay out
me
of pocket.
nervous. You know, I mean, granted, the cost overall, I was diagnosed with melanoma last year. And
Yes.
so that's scary, right? I was
Yes.
very lucky and fortunate that it was very early. They got it. So like the cost out of pocket for everything would probably have been like $3,000, which isn't bad.
It's not bad, but if you had,
But what if it was worse? What if I
it
had to
was
have
worse?
radiation? What if I had to have
Yes.
chemo? What if I had to have a bunch of Mohs
That's
surgeries
where the
or
catastrophic
something?
plans come in, but we're not eligible.
Right.
Like we could go bare and say, well, we'll pay for the regular doctor visits. I could
Right.
even pay for something like that.
Yeah.
But I can't pay for something major. What if I have a
Right.
heart problem?
Yes.
What if I have cancer? What if I have something big or I need some major type of surgery?
Right. Well, and that's the thing. It's like, so
Yeah.
you might have this healthcare plan, and I'll talk a little bit about like you'll have insurance, you have coverage.
Yes.
I have coverage now.
Yes.
But it doesn't cover all of my healthcare.
Right?
So I have to pay out of pocket for other healthcare, like all of my hormone replacement.
Yes.
None of that's covered
Because
because
women don't need hormone
we don't need that.
replacement.
So we actually do.
We do.
But
That's
it
another
doesn't pay for
podcast.
that doctor. It doesn't pay for any of that. So I pay out of pocket because to me,
Yes.
like that's an investment in my health and my
Right.
longevity. And to me, it's worth it. I know not everybody's in that position. You know, my husband, same thing. He
Yes.
sees the VA for all of his health care. And he recently got told he was asking for a certain medication, which we found out is now on their formulary. And the doctor was like, well, it's in short supply and it's hard to get, so I'm not going to prescribe that. So guess what he does? He pays out of pocket to see a different doctor who will prescribe it, and then he pays out of pocket for that medication now.
So,
which is crazy.
So you're paying for health insurance. It's not covering what it's supposed to cover, or
Right.
or it specifically excludes things.
Yes.
So we're paying all this money. What are we getting? So health insurance in America, but I don't know that there is. I don't know. I see on the TikTok,
Yeah.
I see a lot of videos of people going to like Turkey and
Oh,
places
for healthcare, yeah.
for healthcare, dental care.
Yes.
For dental care, a lot of people going other places too, but now lately I've been seeing a lot
Turkey,
of going to
a lot.
Turkey, that they
Yeah.
have like amazing dental care,
And
healthcare.
it's very inexpensive. Apparently, you get really cheap hair extensions down there too. There was a girl that did all of her health care and
And got hair
skincare. She did
extensions.
everything in like one trip, and she's like, "I got a vacation out of it.
Yeah.
This is what it cost me for travel and everything included. This is the food that I was able to eat." Well, it was a really fun like little vlog that
Yeah.
she had done. But she did all the things. Like she saw doctors, she saw dentists, she got her hair done. Like she looked great.
Yeah, and it seems like very quality. I mean, we're not recommending that because we don't know and
No, I
we
have
haven't
no idea.
researched, but it's interesting. And look, I get it because doctors, the insurance that they have to pay, their insurance, like
Yes,
on their medical
their
practice, their
malpractice
malpractice,
insurance, yeah.
what they have to pay. And I mean, anybody who goes through any sort of medical school, any type of like your daughter, the cost of going through any type of medical school and the internships and the residencies and all that stuff. I mean,
Yeah.
these people, bless
so
them.
much debt.
And they
them,
don't
yeah.
sleep for like 3 years, 5 years, whatever it is.
However long it is. Like I think a doctor's like 12 years, depending
Yeah.
on what specialty they're going into, maybe
Yeah.
longer.
Yeah, and
Yeah.
then they come out and they're really now, a lot of them have to work for corporations because these big corporations have bought all the medical practices, and then they're paying all this malpractice insurance, and it's
Yeah.
just, I mean, and we need doctors, so I don't begrudge them what they're earning.
No,
I
it's
don't
not.
think that's
They
the
haven't
problem.
created the issue.
No.
It's
No.
the healthcare industry that has created the problem.
And if I don't know if we've talked ever before about the price of prescriptions, but when you look at like what it costs to buy a medication, the exact same medication in the United States versus Canada or the UK or anywhere else,
Yeah.
the exact same medication produced by the exact same manufacturer
Yeah.
in the exact same thing, the cost is so much more in the U.S. And why is that?
yeah,
Do we
it's like,
know?
well, they can do it.
Yeah.
Which we can't. I think the governments negotiate. Is I think
Is
what
that
I've
what it is?
heard
It's
is that they
lobbying?
negotiate. This is how much you can charge for this medication in our country if you want to provide it here to get it approved, right? Through
Yeah.
those, kind of like our FDA.
Yeah.
They have their own
Oh,
oversight.
yeah, their own oversight. Mhm.
And I think that that's a price that's decided by the government. You know, it's negotiated between the manufacturer and the government. Like, if you want to supply that here, okay, then you can do that, but it has to be at this cost. That's my thought on it, because what else would make sense? So, who's failing us?
Yeah,
Yeah.
somebody's failing us big time because the cost of prescriptions is insane, and that's a problem if you don't have health insurance.
You don't have health insurance
Yeah.
at all, then you likely don't qualify for any of the manufacturer savings, discounts, coupons
Right.
that they have, because you have to have some private coverage for
Coverage
those
for their
normally.
coupons. Yep.
So you got to have something.
And as you get older, like I look at the cost of my mom's insurance,
gosh.
medical medications. She uses something for her eyes, and the cost is insane.
Yeah.
And you know, she has Medicare.
Yeah.
Obviously, she has Medicare, but the cost that she has to pay out of pocket, because I don't understand how all that works yet. I looked up. I'm like, when does Medicare start? When
Is
I
it
was doing
65?
65. I looked it up
Okay.
because I was like, when does all that start? Like, but I don't know how much it helps you. But I still was like, when I was doing the marketplace, I'm like,
Yeah,
I
Yeah.
think it's cheaper in the marketplace. But anyway,
that's good news.
so we don't have any solutions.
No, we're just whining about it.
Yeah,
really.
we're just whining about it. And the only solution I would say that I really do think there should be something done about prescriptions. But I also think that, and I've heard that there's been legislation and it's almost passed or whatever, that groups of people, groups of self-insured people, like maybe like if you own small retail stores too or something, that I'm sure that they have an association too or some sort of group that they can belong to, that you can get group rates without.
Kind of like a union, right? Like,
Yeah,
so if you're like in
maybe.
a certain type of union, don't they have like benefits for those union workers?
I don't-
Even though that maybe they're like all working for independent small businesses. I don't
Maybe.
know.
I don't
Somebody
know.
tell us, like, let us know.
Yeah.
Is that a thing? If you're like an iron worker or whatever,
Yeah.
and you don't all work for the same company,
Or
like
welder
how does,
or something
how does
like
that
that,
work?
yeah.
Yeah.
Electricians, like
Yeah.
electricians, they're all these small little electrician firms,
Right.
but they belong to like the National Electricians, whatever, Institute groups, and I don't know if they have a union, but they have groups that I don't think they can either, honestly. Maybe unions can.
Yeah, I don't
Unions
know.
have very strong lobbies, so
Yeah.
maybe they can do something.
We
But
need a realtor union. Can you imagine? That would be interesting. That everybody would be like, yeah, go ahead and strike. We don't care.
we don't
need
care.
you."
We don't need you. We hate you, and we don't need you.
Oh, gosh.
Anyway, not everyone feels that way.
No.
So, well, thanks for tuning in, right?
Yeah, I think that's it. For
Yeah,
today.
that's it for today. We'll see you next time. Cheers.
Cheers.
Weather forecast today.
Today's forecast.